The debate has been loud and divisive.
We need a public option.
Just say no! I have a question for you.
In the end, of course, that controversial health care bill passed. Still, there's no shortage of dilemmas like this one at a small pharmacy in New Jersey.
That'll be $140.
$140? But that's not possible. I'm sure there's a mistake.
But there is no mistake. A drug she needs to survive is no longer covered by her insurance.
You have to pay the full price.
But I have $20. You don't understand. I'm at the end of my Social Security for this month.
This customer is clearly upset.
$440. It's my diabetes medication.
I know, dear.
I just don't know what I'm going to do.
But the woman doesn't really need help. She's an actor working with us, and so is the pharmacist. And our What Would You Do cameras are rolling to see if fellow customers will come to the aid of a person in need.
Happened several times today.
Rob Fazzini, the owner of White's Pharmacy, is working with us too.
They're either not covered and the patient needs it, or their copays have become so high, the patient can't even afford the med anymore.
According to a recent study, 1 in 3 Americans are not filling prescriptions because they can't afford them.
How about if I give you half the prescription? It would just be $50 more.
She can't afford to be paying that. She lives on Social Security. That's a good chunk of her check. I couldn't afford to do that.
Which makes what this woman is about to do even more remarkable.
Don't be upset. I'm so sorry.
That's $5 this stranger just gave to our actress.
I've never taken money from anybody in my whole life.
It's a necessity.
It's a necessity that Pat Moyes understands all too well, living on Social Security, suffering from diabetes herself. But will other customers be as generous?
It's $140 today, dear.
Oh, that must be a mistake. My copay is $20.
It seems this woman can't help but hear everything.
It's $140.
That's not possible.
And that customer, she appears to be listening too.
Look, how about if I give you half of it, and then it'll be $70, not $140, and then you can take half now.
I just don't have it.
Just seconds later, this woman walks away. But that other customer is about to make a move.
I don't know what to do.
How much money is...
What?
The entire script is $140.
Put $50 on my card, okay?
Please, this is so embarrassing. I'm
Don't be embarrassed. Hey, okay? All right? You know what? Medication is so expensive. There's no reason to be embarrassed. Sometimes we just pass on the good that's been given to us, okay?
Now watch what happens as our actress tries to pay the remaining balance.
Is that all the money you have?
Well, just...
You don't have any cash?
That's the...
Sure, give her back her cash and put it all on my card. Just give it back.
The whole 70?
You just put the whole 70 on my card. Now you have money.
Karen, my name is John Quinones. We're with ABC. You stepped up to the plate, and it was pretty amazing. Why?
Who wouldn't? I mean, who couldn't? Holy crap. You're such a doll. God, who could let this little woman walk out of here without at least a pill?
So, Scott, can you...
We've been taping our experiment for only 2 hours, and in every scene so far, someone has stepped up to help our actress. But is it just a fluke?
I just have the $20.
Okay, well...
That's all I have.
As a woman next to our actress leaves, we begin to think our luck may have run out.
You got to take this every day, hon. You need to pay me for at least a week's supply.
But seconds later...
I'll help you out. I'll give you money. I'll help you out if you need it. Sir?
What?
Yeah.
Let me help her out. I can help her out. Give her money, $70.
You want to do that?
Yeah, I can do that for her. Sure. I'll be right back.
Then, just like that, he leaves, and we're not sure where he's going until our cameras catch him outside, running back from the ATM machine. He'd gone to get some cash.
Okay.
I'm so embarrassed. This never happens to me. I really...
Formulators happen all the time.
It turns out Wally Westervelt works for a pharmaceutical company.
You're picking up the half a prescription?
Yeah.
Again, we can't help but ask why.
You didn't have to do that.
She needs her medication. It broke my heart.
She's a stranger.
That can easily be one of my family members that needs help, so.
He related to her on some level.
He did.
Colgate University psychology professor Carrie Keating.
She definitely looked like a person who was out of options, powerless, and her plight was not her own fault. And that is almost to us the ideal victim who we are likely to help.
Tracy Day?
But what happens when the victim is a younger woman?
It'll be $150.
Wait, $150?
Yes, $150.
Yeah, but I'm supposed to have a copay. I always pay $20. Is there anything else I can take, like a generic?
No, this is a very specific antibiotic.
These customers appear to notice right away.
Okay, well, what if I didn't take it?
Your infection's going to get worse, dear. How about if we cut it in half? You want to cut it in half? It's going to be $75.
I don't have $75. I don't have it.
But neither say a word, even when our actress sits right next to them, visibly upset. Both men look away.
Ms. Day?
Finally, we cue our actress to leave.
I guess I'll just have to come back and do without it, I guess.
I think you got to deal with your own life before you can help somebody else.
So you didn't feel that bad for her?
No, I've seen worse. I know when somebody's hurting.
She was seen very differently than the first actress, who was older.
The older woman looked more like a victim.
Absolutely. This actress was seen as having options and somebody who could take responsibility for her own plight. So we didn't have a major motivating factor there for empathy and helping behavior.
It'll be $150 today.
So will anyone help our younger customer?
There's nothing that you can do or help me out?
I can't give it to you.
I just lost my job and everything. I don't know.
Almost immediately, that woman over there appears disturbed by what she hears.
Can you see if you can get me $75? I'll give you half the meds today.
I don't have $75. I just don't have it.
Well, is there any way that you can...
If I give her 25, can you give her half?
Yeah, okay.
You don't have to do that.
I know I don't.
Why would you do that?
Because I know how you feel, and it's terrible.
But she's not done yet.
How far would that get her?
You'll get her about a 4-day supply.
And how many does she have to take?
She really needs to take for 12 days.
Here, give her 50 and put that on there with mine, okay?
How much?
50.
$50. That's twice what she initially offered to pay.
Gives you 15 days.
Thank you so much.
It's okay. Someday you'll be able to do that for someone else, but I can't let you just...
I'll take it over here.
Ma'am? Excuse me. I'm John Quinones with the TV show What Would You Do?
This woman, a special education teacher, was the only person to help our younger actress.
I'm just doing the right thing. So many people don't take their medicine because they can't afford it. And I don't like that. I don't think it's right.
And neither did these people. Over the course of our 2 days of taping, 6 strangers opened their hearts and their wallets, reaching out a hand to help a woman in need.